Welcome everyone. My name is Haley Buckner and I'm the Professional Relations Manager at Elevate Oral Care. Thanks again for joining us this evening. Before we start, I'd like to cover just a few housekeeping items. For those of you remaining online past 50 minutes, your CE certificate will be emailed within hours of the completion of this talk. So be sure to check your spam folder as well. You're all muted, so don't worry about background noise. And our speakers are happy to answer questions, and therefore we reserve some time at the end for questions. So please be sure to submit those questions on your webinar dashboard. They'll be tracked throughout the talk. Over the past 2 years, we've held a series of free live continuing education webinars on many prevention topics. Each of these webinars were recorded and are available with free self-instruction CE credit at the web address that you can see in the center of your screen, elevateoralcare.com/elevatingcare. Be sure to bookmark this page and return often to see what's new in free CE. Also, if you have a topic that you would like to see covered, please feel free to suggest it by sending an email to info@elevateoralcare.com. For tonight's talk, we have gathered 4 experts on the topic of how patient experience drives both clinical outcomes and practice success. Each speaker will briefly introduce themselves at the beginning of their talks, but if you'd like to see more about their impressive backgrounds, feel free to also email us at info@elevateoralcare.com and we'd be happy to send that information out to you. But in an increasingly consumer-centric healthcare environment, the patient experience has become a critical metric of success for both health systems and clinicians. However, this concept has largely been misunderstood or worse, ignored in oral health. What is the patient experience and why should it matter to you? In tonight's webinar, our panel will explore these questions and demonstrate why measuring and improving patient experience is a key to both patient outcomes and the success of your dental practice. Dr. Carolyn Brown will open up tonight's topic. So Dr. Brown, the floor is yours.
Thank you so much. We'll start with some introductions. Matt, would you like to go first?
Sure. Hi, everyone. Great to be with you all. My name is Matt Allen. I'm a dentist. I live in Colorado. I joke with people that I've spent the last 5 years trying to forget that I'm a dentist so I can better understand the patient perspective. And hopefully you'll get to hear a little bit more about that tonight. I'm the CEO and co-founder of Different Kind.
And Dr. Brian?
Good evening, everyone. I'm Zach Bryan. I'm the director of the North Carolina Oral Health Collaborative, which is a statewide coalition focused on policy reform in North Carolina. I hold faculty appointments at the University of North Carolina at Chapel Hill, Adams School of Dentistry, and UNC Gilling School of Global Public Health. Matt took my opener line, but I often introduce myself as a recovering dentist. So I'm mostly in state policy now. I'm really enjoying that and look forward to tonight's discussion with you all.
Superb. And we have Dr. Jessica Mieske, who is also joining us by phone. Jessica, can you try your mic? Okay, we may be having some technical difficulties still. So Matt, would you mind introducing Dr. Mieske for us, please?
Sure, happy to do that. Jessica Mieske is a pediatric dentist in rural Nebraska. She's a senior partner of Pediatric Dental Specialists of Greater Nebraska, which has 4 locations. She is also highly involved with the Council of Advocacy for Access and Prevention with the ADA. She is part-time faculty at the University of Nebraska College of Dentistry, and she is a speaker. She's just a wonderful clinician, a really empathetic, wonderful person. I'm excited to hear her voice on the clinical aspect of patient experience tonight.
Super, thank you. And I'm Carolyn Brown, and I'm a dentist. I'm also co-founder of A Different Kind, where I'm Chief Strategy Officer, and I'm a consultant working on a national basis. So the topic of tonight's webinar and sort of roundtable, you'll hear us all chiming in, is on patient experience. And part of the key of discussing this is not only talking about how patient experience is different from patient satisfaction, but how it's also very integral to linking to clinical outcomes and to practice success. I think one of the most frustrating things, if we look at this from the lens of both the dentist and the patient, is when the patient comes in for the new patient exam. They spend a lot of time filling out materials, they're giving you their driver's license, their health insurance information. And that's even before you start seeing them. Then they spend anywhere from 30 to 45 to 60 minutes in your office where you're doing work in their mouth and asking them very personal questions. So how frustrating is it for both you and the patient when they go and they leave your office and they don't come back? It is such an opportunity lost. They came in with all of this just inherent trust by giving you all of their information, sharing their medical history, but something about the experience potentially isn't working for them, or there are things about the actual care of dentistry or the way that we talk about it that might not sync with patients. So how can we make sure that we turn every one of those new patient exams into a really great and trusting and long-lasting relationship? And we'll turn to Matt now, who will not only introduce us to the idea and the evidence-based research and work that has been done around patient experience around the world, not only in the US. So I'll turn it over to you, Matt.
All right. Well, thank you, Carolyn. I want to start with a story, and I want you all to meet Dr. Marks. Dr. Marks is a newer dentist. He is very energetic, very enthusiastic, loves dentistry a lot. But I want to tell you a couple things about Dr. Marks, and would love to kind of, you to kind of roll these questions over in your mind. If you want to chat in any answers, that is fine as well. But Dr. Marks, despite all of his enthusiasm, often when he sees patients, he misdiagnoses caries, he inappropriately assigns caries risk, he leaves open margins on his restorations. He oftentimes will break off roots of teeth during oral surgery and actually not get it. He doesn't find all the canals when he's doing root canals. And so my question for you is Dr. Marks doing his job? And I think, most of you are probably saying, of course not. No, he's definitely not doing his job. And so Dr. Marks gets involved with his local dental community. He figures out where to get some great online CE. He, figures out, okay, I'm going to get better at all these things that I'm not doing a great job at right now. And he gets better. He's actually better in all of those aspects that we just mentioned. So he's appropriately diagnosing caries, he's appropriately assigning caries risk, and he's doing great restorations and great oral surgery and great endo. Is Dr. Marks doing his job now? Well, let's think about this for a patient that he brings in named Maria. So Maria comes in, he does all of those things really well, perfectly, in fact. And he says, all right, Maria, we've had a great visit today. We'll send you on your way. And Maria goes to the front, goes to make her next appointment, and the front desk person realizes that they actually brought back the wrong Maria. There was two Marias coming in today, and this one had happened to come a little bit early. The other one was a no-show. So they actually did the wrong treatment on Maria. So did Dr. Marks, and by extension, the rest of his staff, did they do their job? And hopefully we're all saying, of course not, no. And so there's obviously an element of patient safety to being a great dentist and doing a great job as a dental provider. So let's imagine again that Dr. Marks figures that out. They develop some systems to say, okay, we're gonna never let that happen again. Here's how we're gonna do that. They figured that all out within the office. So Dr. Marks, sees another patient a couple weeks later named DeAndre. DeAndre comes back. It's the right DeAndre. Dr. Marks has all this clinical skill now, but unfortunately, DeAndre leaves feeling condescended to, talked over, unheard, unlistened to, ashamed, kind of like he went to the principal's office. Did Dr. Marks do his job? And so the point of this story is that there's lots of elements here that go into shaping overall clinical quality, effectiveness, safety, equity, timeliness, lots of different factors. And we just saw a few of them there. And so tonight, what we really want to focus on is this idea that truly exceptional clinical outcomes and practice success aren't possible until we understand, measure, and improve patient experiences. And so I hope tonight that we can move from my job is to provide just effective surgical care for my patients. That's my job as a dentist, to I can't provide true quality unless I focus on patient experience. It's certainly a huge part of what we're doing. And so if you're along with me for the ride there, if you're saying, yes, I buy into that, I agree with you, see what you're saying, then you might be asking yourself the question, all right, well, what can I do? And so we hope to give you two things tonight that you can actually do to really focus on that patient experience and actually improve it. So the first thing is actually understanding what patient experience is and why it is important. So I want to dive into just a little bit of the kind of background there before we start to hear from Dr. Mieske and from Dr. Bryan in terms of their perspectives on this as well. I think it's really, really critical. And so I want to start as I often do when kind of explaining a concept that maybe is a little bit misunderstood or not understood at all, with a definition. And this definition comes from Adrienne Boise. She was the former Chief Experience Officer, which hospitals have those. That role is a real thing at hospitals. Chief Experience Officer of Cleveland Clinic. So obviously, I think we're better now. Very successful hospital, very well-known hospital, and she's currently the Chief Medical Officer at Qualtrics. And this is how she defines patient experience as the sum of all interactions across a patient's journey that drive loyalty and trust. And I think that this driving loyalty and trust thing is something that is really, really important, right? It's one thing for a patient to say, yeah, that was kind of like I had an okay experience, right? Or even I had a good experience. But am I coming back? Am I coming back again and again? And when things get tough and something goes wrong, do I continue to trust you? Do I continue to be loyal to you? Are you my person? Are you my dentist? Are you my dental provider? Right? That is a really big part of patients coming back. I think we'll tell some stories tonight that hopefully drive that piece home right there. So I love this definition, pretty simple, right? The sum of all interactions, and especially in a post-COVID world, that's obviously including things that are happening outside of the dental clinic. But the dental clinic has a lot of specific things that we can do while we are in the dental clinic to really drive that loyalty and trust. And we're going to talk about a lot of those things tonight as well. All right. So let's talk for just a minute. Carolyn, I know we've talked about this question here before, and we kind of heard from Haley at the beginning here. Is patient experience the same thing as patient satisfaction? And I kind of want to just touch on this because I think that these terms tend to be used interchangeably by people, and they are different. So I kind of want to talk just for a second about what that is. Patient satisfaction really looks at, hey, were a patient's expectations met? And if you talk to patients a lot of times, what are their expectations of dental care? And oftentimes those expectations are, I expect to go in and be poked and kind of prodded and maybe talked over while I'm laying down, and I expect to bleed, right? That's generally most people's expectations of dental care. So the bar is pretty low, I think, for a lot of patients on what they expect. Whereas patient experience is really measuring, did something happen or not? And the sum of all of those things, as we just saw in the definition, really does drive that loyalty and trust, which is different than just, hey, were you satisfied, right? And so we have different ways of looking at these things, but they are different. And I think it's important for us to recognize that one is just, hey, were the expectations met? And the other is, did certain things happen that we know are important? And we'll talk about what some of those things are later in our session today.
Yeah, and I think, Matt, it's also, how do you tease out, chair side manner for a dentist? And I think, we can be really, kind and thoughtful and inclusive of our patients as we're talking. But, one of the important things in that definition is the patient's journey. So if we make things really difficult for them by asking them to continue to fill out the same paperwork every time they come in, or it's not in their language, if there are other barriers for them to actually sitting in the chair, or if we're not really transparent ahead of time around their out-of-pocket cost, I think those things also, are really important. And that's part of what patient experience pulls in, but then there's also that clinical outcomes piece. So Dr. Meeske, I think you're with us by the phone. So if you can unmute and, let's roundtable it. So from a clinical perspective, Jessica, can you, maybe see that given that satisfaction is what patients expect, how can you help shape patients' expectations of their dental care as a clinician?
Okay, great. Well, I apologize for my technical difficulties getting on, but I'm here now. So for me, I'm a pediatric dentist, so much of my patient satisfaction is essentially parent satisfaction with the visit. And many times, because 50% of my patient visits come through referrals, these children come in with problems, often severe problems. And I think the key for us is to listen to what the parents' concerns are and try to address what that chief complaint is first, and then build from there. And I find oftentimes what we do that we shouldn't be doing is we're completely overloading the parent with too much information. Your kid has an open bite because they're 4 years old and still on the pacifier. Your kid has 12 cavities. Here's how we're going to fix it. Oh, here's what's causing the decay. And we just completely overload them with information. So that's something we're trying to work on hard in my practice.
Fantastic, thank you. And I think that's a really key point. You have two audiences to try and, you know, make sure there's a good patient experience. The parents first and foremost, but then also, you know, the children wherever they are on their, you know, kind of maturation. And Zach, Dr. Brian, I know that you know, you're a policy expert and you do a lot of work in a broader public policy context. Can you know, maybe comment on, you know, the differentiation between experience and satisfaction and how to change expectations of dental care from a policy level?
Yeah, Carolyn, that's a great question. You know, for us at the collaborative, because we are focused in the policy space, but we have access to, you know, a plethora of different perspectives, we try to always carve out pathways for the consumer or that patient to actually be elevated and have a seat at the table when decisions are actually being made that impact the policy landscape and public health. So sometimes that looks different. So it could be asking for testimony to payers on what they find most valuable. So giving a platform for patients to actually meet with private and public payers to share their lived experiences. What are they seeking out of the experience? And what are they not getting? And then we also find that there are other ways that we often will elevate their voice through video testimony or guest blogging, those types of things. The community itself, I think, is really not attuned to having those opportunities. And so when they're given the platform and really supported to share their experience, I can attest they do not hold back. Which I think is why it's so important that we're having this conversation tonight, because it's really important for providers to understand maybe what we assume wrongly is a good experience for a patient is not actually what they walk away with. And so it's really important to look at it from a different perspective. And a very kind of basic example of that is also by allowing that consumer community to reach positions of influence. So as providers, we have influence, you know, and there's a power differential intrinsically. And so we want to make sure that we give the consumer perspective and shift that power a little bit. And so we will often allow, you know, and give platforms for patients to meet with legislators and share their experiences. We did this recently, and it was with our Latinx community in North Carolina, and they shared about not having linguistically or culturally appropriate services in oral health across the state, which really seemed to open the eyes of our elected officials. So, you know, that's kind of just scratching the surface, and I know we'll dive in a little bit later into more of this, but we definitely want to make sure the platform is authentically present and we are engaging the consumer throughout all phases.
Yeah, that's really interesting. I mean, I think, first of all, even choosing to call, you know, what we normally call patients as consumers, you know, kind of changes that power differential in and of itself. And we could talk about a lot of the consumers and the individuals out there who need or want to access dental care, but have fear or have other things that prevent them to coming in for dental care to then be called a patient once they're in our practice. Is there anything else that you can add, either Dr. Brian or Dr. Mieske, on what dentists can do to start to really think about patient experience versus patient satisfaction?
Sure, I'll start with that. I think really taking the time to understand, in my case, where the parent and the child are coming from, and understanding the world that they live in. I had a teenager in with special needs today, nonverbal, non-ambulatory, and there was just calculus and plaque all over the teeth. And we had worked so hard with the parents on taking proper care of the teeth and having her in for 3 months instead of 6 months. Well, when I took the time to ask how things were going before I started in about the poor oral hygiene, she had just gone through a divorce. She had lost her home. She was worried about paying her kids' college tuition now that she was becoming the financially in charge parent in this case. And so, just taking a minute to say, I'm so sorry you're going through this. And, let's take this off bit by bit and see what we can do to help you with the kids to make sure dental is not one of the things you have to worry about this Christmas. And so often for me, because 50% of my patients are low income and very high need, it's just taking that step back in that 30,000-foot view of where your families are coming from and what is their immediate concern right now. It may not be a tooth. It may be just trying to figure out where supper is going to come from.
And just to add and kind of underscore what Jessica was saying, absolutely. I mean, I think it's critical we really intentionally avoid assigning our own values or lean into our biases and do that introspective work and try to get to know our patients as people first, not as patients. And so it sounds really basic, but we often get caught up in the minutia of dentistry, and we are really hyper focused. Believe me, as I said, I'm a recovering dentist, so I understand how it is, but we often forget of all the aspects that make up the patient's lives, just as we're very, complicated as people, as dentists as well. And so, don't lose sight of that and make sure that you're always trying to actively engage and listen and affirm those experiences that the patients have.
Great.
Well, Zach, I want to jump on that as well, because I think you just said some things that I think really lend itself to the evidence as well, because I think, what do people actually really want from their dental experience is a really great question, right? And so I've really been interested in this question. And so I've done a lot of literature searches on this. And one of my favorite, actually, we can look at the evidence and say, are there studies out there that actually show some of this? And obviously we're looking at a specific population group in this study, but they did this study in 2012 in Australia, and they said, hey, what do people value from their dental experience? And it's funny that you say people want to be treated as people and not as patients, because that's actually one of the findings that they found, exactly that. I think a few other, kind of highlights from that study that I think are relevant for our discussion tonight too include, for a lot of patients, just the offer of prevention is this like revelation. So instead of just like having to drill and fill or whatever, right? Like just the offer of prevention. Hey, we can do some things that can help you prevent cavities. Would you be interested in hearing about that? Is like mind blowing to patients, right? From their previous dental experience of every time I go in, I joke that a lot of patients come in just like fingers crossed all the time, right? Like, I hope I don't have cavities. And no one goes to see their PCP like fingers crossed, like, I hope I don't have diabetes, right? Like that's a very different experience, and we're both managing chronic diseases. So that's a huge revelation for them. Listening to their concerns without blaming, I think, is something that stood out to me in that study. But ultimately, I think what people wanted was they wanted help taking control of their own oral health. So are we actually doing that? I think that's a big part of patient experience versus patient satisfaction, right? You can be satisfied when someone is just doing some things to you, but experience is really moving more towards that partnership and that, hey, we're going to work together to actually make this happen. So I love some of your thoughts there, Zach, because I think it lends itself to exactly what the evidence has to say. All right, so one of the other questions that we tend to kind of think about around this is, does patient experience impact clinical outcomes? And so again, want to just quickly like highlight a little bit of the evidence around this, around one area of kind of patient experience that we can measure, and we'll talk about that later, that impacts clinical outcomes is on the medical side, because many of these studies have been done in medical. But what they've done is said, okay, let's look at an aspect of patient experience like clinician empathy, and say, does that impact clinical outcomes? And let me just, I'm gonna have my notes here because there's so many good pieces of data that I can't remember them all. And so just want to share a couple from many different studies here. So 700 clinical encounters of patients who had the common cold. So I think we all kind of forget what that is like in the age of COVID, because every sniffle is like, I have to take 5 COVID tests now, right? But the common cold still exists. And for patients who reported their physicians had perfect empathy scores, they reported that their cold was less severe and that it lasted fewer days. And not only was it just patient-reported measures, but it was also, they looked at quantitative measures like levels of IL-8 and nasal neutrophils, and they found that they had higher levels. So their immune response was higher when their physicians had a perfect empathy score versus when they did not. To me, that's fascinating. 710 cancer patients in Germany, physician empathy was positively associated with an improvement in depression and quality of life. Who wouldn't want that, right? If your family member had cancer. Look at other chronic diseases like diabetes. Perfect or high empathy scores in physicians. Patients who rated their physicians that way had a significantly lower rate of acute metabolic complications. More diabetic studies showing that good empathy scores were significantly more likely to have good control of A1C and good LDL-C levels, right? Awesome. We want those things as clinicians. And lastly, like in treating people for depression, therapeutic empathy had a moderate to large causal effect on recovery from that when being treated with cognitive behavioral therapy. So lots and lots of studies like that out there we could go on that show that, yes, patient experience, right, the report of clinical empathy, just one aspect of patient experience, can and does have a really big impact on clinical outcomes.
So I think given some of these examples, Dr. Miski, can you talk about one aspect of patient experience, empathy, that could impact clinical outcomes? What have you focused on in your practice, or what have you seen from a particular case?
Sure. I think the number one thing that we do in our practice is alleviate a toothache the same day that the family calls. And one of the things I'm really amazed about is how many parents will call and say, we've called 10 different dentists. I've told them my child has a toothache or their cheek is swollen, and no one says that they can get us in. And we kind of have taken the approach that the number one thing we can do, I think, to satisfy a parent is to see their child in the case of an emergency and do everything we can to just alleviate that pain immediately. Fortunately, in pediatric dentistry, much of it is just taking out a abscessed tooth, or you're waiting for a child to go to surgery, but you're booked 2 or 3 months out. Okay, mom, we need to do this emergency extraction. And taking the time to explain why we need to do it now, how the child is going to feel immediately better. But I think even for myself, when I'm a patient consumer, if the provider can help me with my acute symptoms right now, if it's possible, whether it's a urinary tract infection or whatever it is, it's just amazing, I think, how much satisfaction and loyalty they'll have back to the provider in the practice. So that would be my number one example.
Super. That's a really great example. And Zach, how can we take this type of research and use it to help change policy or education and to incentivize this kind of work? And are you doing anything like this in North Carolina, or is it on your roadmap?
Absolutely. I mean, to me, I think the research really only further underscores even those in public health dentistry have what we've tried to accomplish in terms of changing the tide for so many years and been unsuccessful at it. And that is that patients, acknowledging that patients bring in with them an immense degree of historical trauma. They often have extreme fear and misunderstanding regarding oral health due to these traumas, and carry with them a lot of shame, which Dr. Allen mentioned earlier, from those experiences. So I think to create a more empathetic and safe environment for patients, we do first need to start with ourselves and educate ourselves, which is sometimes tough and internal introspective work that needs to be done, but it certainly pays off. And we also need to acknowledge how society has created an inequitable system. So the system in which creates historical trauma or trauma needs to be addressed. And so in North Carolina, one of the things we're doing is we have engaged a new initiative called the Patient Advocate Initiative. So when we think about, we have advocates on our side, right, as dentists. We have the ADA, our local state chapters, and the list goes on. Payers have advocates. Where is the patient's advocate, right? And so I hope that this talk inspires you all tonight to be that patient's advocate, But in absence of that, in patients trying to navigate a very difficult and arduous system, we want to provide that to them to then measure the impact that has both on satisfaction and outcomes. And then I think back to the policy perspective, though, it's really important that we do two things. We don't just assume that oral health is a closed system, A, and that we need to do this alone. So we really do need to be engaging in a more interdisciplinary approach. So we need to engage our medical colleagues in the oral health conversation, and we need to start early. So as I think about dental students' curriculum, I think CODA in particular needs to play a role in outlining some of these competencies through meaningful experiential learning experiences for students around trauma-informed care, understanding motivational interviewing principles, etc. I think we don't really equip our new graduates with the information that they need to be able to really lean in more authentically to the empathy that we've just discussed.
Love it, Zach. Man, that's so much good stuff there, and Jessica as well. So many great thoughts there, and we'll certainly come to that idea of getting an appointment when you need it is a huge driver of experience, right? So obviously this matters for patients. I think we can hear that, right, from these studies and from what both of you just shared. One question that Carolyn, that we've talked a lot about is what impact does patient experience then have on the bottom line of a practice? And so I just want to share a couple of thoughts before we hear from both of you again. But I think I want to share a quick story of just this physical therapy practice in Arizona who moved from, hey, we just send out some patient satisfaction surveys to, hey, we're really going to try to understand patient experience and what impact will that have. And what they saw was that the first year that they really moved to a more patient experience approach, they saw an additional $300,000 in revenue in their practice with an additional $200,000 in potential revenue. They saw a 12 times return on investment, right? And that's in a physical therapy practice where, a lot of their patients need to come back again and again and again, right? To be able to get better in the same way that we want our patients to come back and again. So I think that there are some parallels there. I also think that there are a lot of indirect costs to this as well. And when you look at the literature around this, right, the patients who are less likely to sue if they have something bad happen, obviously that's a big financial impact, and just lower turnover in general. I think we're seeing right now in the middle of this kind of huge recession that people are leaving their jobs in droves. If your patients are satisfied, it's a more inviting work environment. The culture is good. And there's probably lower turnover there as well, which obviously has a really high cost if our staff is turning over all the time. So those are some of the things that I think of when I think about the impact that patient experience has on the bottom line. Carolyn,
I think I'll take what you just said, Matt, and kind of roll it over to Jessica, talking about, COVID and the impact on dentistry. And we hear, kind of across the country around, staff turnover and resignation and people leaving the dental workforce and hesitating to kind of come back. Can you talk a little bit about the type of culture that you have at your practice and how that affects your ability to, A, keep your staff, what that looks like in terms of bottom line, and also what it means to your patients? Because I think that, I would say that patient experience is probably pretty analogous to like that office culture. And, it's hard to have success in one area without success in the other.
Yes, I definitely agree with that. And I would just say, number one, when we all faced the COVID shutdown for a number of weeks, I think dentists kind of fell into different groups. Ones that just panicked and did shut down and didn't know what to do. And then there was a group in the middle that said, okay, it is what it is. We'll do the bare minimum. We'll pay the staff the bare minimum or not pay them at all. And then when we come back, we'll figure it out. And then I think there was this group of dentists that said, you know what? We've been faced with one of the biggest challenges we will probably see in our lifetimes and our careers of running small businesses or clinics. And how we determine how we're going to respond to this challenge is really going to help define the next 18 months of our practice, if not farther. And so what we did was immediately had managers come in We looked at the COVID relief packages. We let our team of 48 know that, we were going to be making sure that we could keep as many people on staff, and there was important work to be done and projects, and we would try to implement new things like teledentistry. And then in terms of once we came back and things were starting to get back to normal, when we had our parent satisfaction surveys, and ours are just done through their phone and it's not sophisticated at all, but making sure we celebrated those wins and those positive parental comments at our team meetings, at our morning huddles. And one of the first families that came back after COVID was a COVID nurse who worked at the local hospital with her 4 kids. And I just said, thank you so much for what you're doing. You're working with COVID patients every day. But when you entrusted us to take care of your kids, knowing that COVID was out there, I want you to know what that meant to me and my team of people. And she said, of course, why would I not bring my kids to the dentist? And I said, can we take your picture? And so we just have something to really celebrate and embrace. And she said, absolutely, we're all in this together. And those are just the kind of moments you can't recreate with your team. And so taking time to celebrate and put them at ease and saying, if this nurse who works with COVID patients every single day trusts us and feels comfortable bringing her kids in for checkups, we know that we're going to be okay, and we have to be there for our patients and our patient families.
I mean, Jessica, I'm not even on your team, and I was getting a little choked up. So I'm sure it is good to be able to share that with your team. And
yeah,
Zach?
I really got choked up too, Carolyn, when I had a couple of hygienists show up 2 days later with more than an hour of commutes, kids at home, and they had brought their sewing machines and started cranking out cloth masks in the basement because they knew that the real PPE needed to be worn by the clinical staff and there would be a shortage for the public, and therefore they made masks for the little kids to wear in the back. And I just, for me, what that meant as a practice owner to have that dedicated of staff that just started to pivot and think about what can we do to pitch in, that got me choked up, Carolyn. So I'm right there with you.
Wow. And Zach, on like the policy perspective, I think, we know that patient experience and patient experience measures on the primary care side actually relates to how they're paid by Medicare and by certain plans. Can you talk a little bit about your experience in looking at policy and how we can incentivize dentists to be able to look at these types of things and to be able to measure patient experience and things like this?
Yeah, definitely. I mean, I think some of it is complex in that we have to start back to where we started the conversation about the patient and centering the patient's voice. In that when a lot of these systems are designed, who is designing them? How are they designing the measurement tools? How are they designing the measurements themselves? So it's really important that the patient has a role to play in that as it's designed. I don't know that we have enough time for me to go into my spiel about the quality piece, but I have concerns around how we measure quality in oral health, particularly because we really don't do risk-based billing. And our payment system is a little bit flipped than what we need to see. So, I think you need to make sure the patient has had a chance to actually design those tools, have input in what questions are asked. And then how do you engage? How do you actually engage the patient to respond? Do they have psychological safety, right, to respond truthfully? And I am always a little bit hesitant when incentive payments are tied to patient satisfaction because I feel like it can actually drive inequities, particularly for patients who are marginalized already. So for me, I'm not sure that I like seeing incentive payments tied to patient satisfaction And then for the quality piece in particular, I think we have a ways to go in incentivizing kind of an alternate payment model type value-based care system to be able to really understand what we did for a patient, not just what we did to a patient. And so start early with patients in the design and make sure that you give them ample opportunity to respond and that they feel comfortable and that they can respond truthfully.
Love it, Zach. All right, well, so that was, essentially this idea of, at the beginning talking about, hey, if we think patient experience is important, what can we do? So hopefully we've given you some context for what patient experiences is from a lot of different perspectives, why it's important. What's the second thing you can do if you think that this is something that truly matters? And the second thing is just measure and actually improve it. That's number two, pretty basic, right? And so we actually have a poll. Steve, I don't know if we can get that launched, but we do have a poll on patient experience in terms of how you're currently measuring patient experience in your practice. And so if that's something, Steve, that we can do, I know we also had some technical difficulties on our end getting things going here with some challenges. Oh, there we go. We do have it. So how do you currently measure patient experience in your practice? Select one of the following. Hopefully you have a better idea of what it is now, but would love to hear kind of how you're actually currently going about doing this. How do you currently measure it? We heard from Jessica, hey, sometimes we will call patients or whatever, and we'll talk about some of the ways that we can actually do this work moving forward. So please submit an answer there as you do that. We'll leave that up here just for a second. And it'll close in a little bit. And then we'll talk a little bit about measuring and improving patient experiences over the next kind of 12 or so minutes and make sure we leave a few minutes here for questions at the end. All right.
Yes, and Jessica and Zach, I know, Zach, you also practice still at an FQHC, and Jessica, are there other any other opportunities or any other tools that you've used around patient experience, or if it's not quite to patient experience, where you are with patient satisfaction and how frequently?
I think Zach's probably farther ahead than I am, although I'm starting to travel down this road of doing a more sophisticated measurement system. I think one of the best ways to anecdotally measure patient satisfaction is when they start looking at cosmetic procedures or orthodontic procedures. And so they have trusted you with their basic needs or their restorative needs or emergency needs. And now they're moving out of that. They're well controlled and they're saying, I've been so satisfied with my experience here. I want my child to experience that next level of care. I want them to have straight and attractive teeth. And to me, that is one of the ultimate compliments. And particularly if the request comes from a family that may have modest means. And so, when they have skin in the game for, $1,000, $2,000, or $5,000 worth of aesthetic care out of pocket that they're now choosing to do because they value it that much, I really find that to be very motivating and satisfactory to me, knowing that they want more of what I've done for them.
And I would just add, for us, and obviously preface it by saying my perspective is based on a public health model with an FQHC, but we've looked at who the messenger that's asking the question is, because we know that trust obviously is often eroded, as we mentioned earlier, but we actually leverage a lot of the community-based organizations to be the ones that host focus groups and send out surveys based on patient experience from ours. So we contract with them. So we aren't actually, as the FQHC, sending it out. It goes through a third party, quote unquote, but it is a third party who our patients and our patient populations actually trust really heavily. And so we do feel that the responses we get back are often more genuine than we might get if we were just polling them at our site.
Great. All right. Well, thank you guys for that perspective. I'm not sure if the poll is closed yet because mine says something different than I think what all yours says. I'm going to keep going though here. All right. So one of the things that I think we hear, on this idea of then, okay, well, how do I measure patient experience is, well, I already have like a lot of Google reviews. Isn't that what you're kind of talking about, right? And going back to that group that we were talking about earlier, that PT group in Scottsdale, certainly they had a lot of positive Google reviews, and Google is great for a lot of things, obviously. Google reviews are not really a patient experience tool. By not really, I mean they are not, right? It's a marketing tool. You can learn some things, and there's definitely some things to be learned from that, but it's not really a patient experience tool for a few reasons. Number one is it doesn't actually, ask all patients, right? Like you don't get all of your patients responding, so you are getting a small subset. And I could choose who I want to respond in certain ways, and so that's a problem. It also, doesn't necessarily have to be actual patients, and there are certain platforms that make sure that, hey, it has to be a verified patient or whatever. But certainly Google reviews is not that way. And then number three is, that information actually isn't transparent back to patients. So they, can you really trust it? And I think we're seeing a lot of actually happening of, can I really trust this moving forward? And so Google, while great for a lot of things, like I mentioned, is not really the platform that we want to use to measure and improve patient experience. So what could I actually use to measure and improve patient experience? And I think, Zach, you touched on this here just a minute ago, the idea of kind of focus groups, right? So this is from the UK, which is where a lot of the best patient experience work has been done. And what we see is this idea of kind of these different, hey, is it more generalizable versus less, or more descriptive versus less? And so, there's lots of different ways that we can actually measure patient experience via a number of these tools. I would say for a lot of us, the idea that we want it to be more generalizable, we want to kind of understand the whole experience that everyone is having versus maybe one person's experience in general. And then also something that, is not pages and pages and pages, like you might get from a focus group, which can be really helpful. So I see a lot of the solutions tend to fall in this kind of top left section here around surveys, kiosk questions, things like that, right? And Zach mentioned surveys as well, is certainly a way that we can use to, these are ways that we can measure this experience before we actually work on improving it. So Steve, I'm not sure if we're continuing to move. I don't know if that poll is closed or not, but if it's not, I don't.
Dr. Allen, yes, I did close the poll. It's shared, I believe it's shared on screen for a brief second here, but I can give you the results.
Okay.
We had 33% clicked on we don't, but I'd like to. 20% clicked on internal solutions. 25% third-party solutions. 20% on other, and then there were 3% on what is patient experience.
Okay, great. So I think a pretty, nice distribution between a lot of different answers there. If you can't see the slides on screen right now, please let us know. Feel free to just put a question or a chat in or something like that. We want to make sure it says it's showing it on mine, but it's actually, I don't see it. So I just want to make sure.
Yeah, Dr. Allen, I believe you will need to share your screen or program again.
Okay, I can stop showing my screen and then reshare. How about that? There we go.
Yeah, and if you can go back to that slide, Matt, yes, great, we didn't see that.
This one, yes, this is what we're talking about here, yeah. So so I love that, Steve. I think that gives us a general sense of the audience. Zach, Jessica, how are you, what have you used in terms of some of these solutions? I think we've heard a little bit about this just a minute ago. Anything else that you want to add to what you just shared in terms of how you've already thought about measuring patient experience? If not, that's okay too. Just want to give you the option.
Well, I do have one, and it is not scientific like the wonderful platforms that you have, but I do think it's very effective. And that is when I get a very frustrated parent who, particularly in my area of rural Nebraska, they weren't able to find a dentist that accepted their Medicaid insurance. And they'll finally get to us, and while after we've done the new patient interview, we bring the child back. I give mom a pen and paper and I say, I want you to tell me what you've gone through in order to get your child here. Please tell me your story. And they will write out these very elaborate stories of how difficult it's been. And it really helps them to understand and kind of vent what they've gone through. It helps my practice to understand. And then I use it as a policy standpoint with my state dental association or with senators if I'm trying to move a policy or a bill forward that's having to do with access to care. And I save these letters in a 3-ring binder, and they're incredibly effective when you speak with legislators about all kinds of public health and access to dental care issues.
That's fascinating, Jessica. I love that. So in the idea of keeping with time too, I want to make sure we leave a few minutes for questions here. So I'm just going to continue to roll here in terms of then. So if we're looking at feedback then just on like a general level, this is my perspective, right? As what I want to see as a patient, that we do get feedback from all patients, like I just mentioned, that we do, or at least we solicit that. We might not get it from everyone, certainly, but we want to solicit it. We want to get feedback from actual patients. And then I think we've talked about trust, and I'll talk about this again in just a second, and we'll get to hear everyone's perspective on that. But the idea that feedback is transparent and, you know, allowing that to drive the whole profession and getting better, in addition to our individual offices saying, hey, we're willing to show, you know, we're not going to put this in a black box somewhere, we're willing to show it to you, I think is really key in driving trust from patients. And, you know, I think to answer the question of the webinar, right, which is why don't patients come back? I think as a dental profession, we've spent a lot of time. So if we think about the patient journey here, and obviously there's more steps that we can add, this is a pretty simplified version of, you know, awareness, consideration, conversion, and retention. We've spent a lot of time as a profession thinking about the first 3 steps, right? Like, how do we get patients aware of our office, and how do we get them to, you know, actually want to come, and then how do we actually get them in the door? We've spent a lot of time thinking about those solutions, and a lot of the solutions that we've spent thinking about have been designed to improve convenience. So looking at things like, can I make an appointment online, or can I offer payment plans like buy now, pay later, or, you know, some of those types of ideas. Do you have flexible hours? Can I pay by text? Can I digitally complete the forms like Carolyn mentioned earlier? Lots and lots of solutions out there for those, and those are all really, really important. And a lot of those are designed for convenience, which are important because people want a convenient experience, right? We live in a consumer age, and it's not, you know, beyond us as dentists to not be affected by that. But unfortunately, this last bit right here, retention, is really driven by a lot of trust, right? That loyalty and trust of a patient or of a provider. And I think that we've missed out on solutions that look at those kinds of ideas, things that drive trust, like, hey, provider continuity, or communication training, or behavioral interviewing, or, you know, measure transparency, and just simply promotion of a culture that enables those kinds of things. Until we actually really do those things, we won't build that emotional trust necessary with the patients to get them coming back again and again and again. And I think sometimes patients will continue to come back. They might come back a few times because it's convenient, that it's close to their house, or whatever it might be. But unless you really have that emotional trust from the patient, we're not necessarily going to be able to get them to continue to come back when things get hard, right? When they have to wait on hold for more time than they'd like, or when something bad happens in the office and an outcome doesn't go the way we want, do they just go seek somewhere else, right? But a truly trusting patient will actually continue to come back because that relationship is really strong. So this is something that I think, you know, really is helpful for us of, hey, we need to spend more time thinking about that idea of trust versus just making things easier for patients. How do we do that really well in our offices if we want patients to continue to come back? So Carolyn, thoughts on that? Zach, Jessica, thoughts on that?
You hit it on the nail on the head, Matt. I mean, I think it's absolutely, and one of the things we've seen, particularly when I was more heavily in clinical practice, we would do more touch points and engagements with patients in between their visits. So you would be surprised, and Jessica, I'm sure you've had this experience too, when you call a patient yourself, right? You're not asking your assistant or the front desk to call a patient. The doctor's calling the patient, and you're asking them not just based on, post-operative, but you're asking questions about their family, how are they doing, sending out, more personalized cards around the holidays, those types of things. Like everything that happens outside of the dental office is really important. And I think people lose sight of that. So definitely make sure that you're engaging with your patients outside of the dental visits that they have.
Totally. Well, I think, when I think about this, I look at it and I say, well, who are some of the leaders in this and where is this happening, right? And so in medical practice, you look at somewhere like the University of Utah, they're doing a great job of this, right? If I want to see a female provider who speaks Spanish, right, who practices family practice, I can go on their website and find Martha. And then I can kind of see how's Martha doing? And I actually see, oh, wow, 3 of the 5 measures that they're showing me here are trust measures, right? Like, did they explain things well? Did they include me in decisions? Did they show concern for my questions and worries? They also include convenience things like wait time. But when we look at the overall driver of what's the likelihood of recommending this provider, we see it's a lot more of the trust factors. The number is much more corresponding with that number than it is with the wait time, right? So patients are willing to put up with a little bit of wait, even though they might not be happy with it, because right, they trust this provider. I mentioned Cleveland Clinic earlier and Adrian Boise. And what are they actually doing around some of this? Well, they have 4 kind of patient-first measures that they look at. So teamwork, empathy, safety, communication, and ease. Again, some of these are trust measures, right? Teamwork, empathy, communication are trust measures versus ease, which is a convenience measure. And so they have specific questions that they look at around these things. And when we think about this at different kind, we want to have some of those trust measures of being caring and respectful, inviting people's perspective and partnering with people, giving people a voice when deciding on treatment options like Zach has mentioned, as well as what Jessica has said. Did I get an appointment when I needed it? Could I get my kid in today? So when I look at some of these, hey, this is what some of the leaders in this space are doing. These are some of the things that we're seeing out there, and that really resonate with me. Zach, Jessica, Carolyn, other thoughts, on this? Like when you look at this, how do we bring more Cleveland clinics and University of Utah's into the dental space? How do we help patients have that kind of experience with their dental providers?
Well, I think just finding a more meaningful way or platform in order to get this data back and use it to drive decisions about your practice. So if you're looking at, we need to do a new hire, well, maybe it needs to be someone who's a treatment plan coordinator, who's making follow-up visits to parents in my case. Are you ready to schedule your child for treatment? Do you have any thoughts or concerns about that? And just asking those open-ended questions to really understand what's going to drive the parent or the patient to take that next step. And then what are the barriers for why they don't want to take it? Is it fear? Is it cost? Is it COVID? And then really hearing it.
Love it. Zach, how about you?
Well, Matt, I think you'll have folks on 2 sides of the spectrum. I think those that intrinsically want to pursue this because they feel there's an altruistic reason behind it, and those that might need to be pushed. I know this is not a popular opinion often, but I do think the payer system needs to get involved and start applying payment to these measurements that are, again, as I mentioned, patient designed and co-designed with providers and the payers, so all 3 together. But I think until the payment system is reformed, some may not get on the boat. And so we may need to see some push for the boat to leave the harbor.
Yeah, and I would just add to what Zach is saying. I sit on 2 dental advisory panels for insurance plans, one on the public Medicaid side and one for a private dental insurer. And these are dental medical advisory groups that talk about issues and what's working and not working. And the voice that's always missing at the table is the patient consumer. And we all think we understand how the system's working, but of course we're looking through the lens of providing the care and filing the claims. And I think it'd be really wonderful if more payers listen to what the patient consumers are saying about, hey, it wasn't easy for me to navigate these series of appointments in order to fix my problem.
I think that's a great.
Oops, sorry.
Go ahead.
We're running up on time, but I'm just going to pull out two quick things that I'd heard on the webinar, and that is also including prevention. So, you know, oftentimes we think of fluoride varnish for children, but we often leave the prevention piece out of the adult treatment plans. So this is where I think, you know, we have a lot of opportunity, be it, you know, 5,000 parts per million fluoridated toothpaste and other things, that if we, you know, really stress with our patients and provided opportunities for them to be able to not just pay for that high dollar, you know, restorative treatment, but also continue to stress those other things, we might see that, you know, return on trust pretty quickly.
Love it. All right, so hopefully we have given you some understanding of what patient experience is, why it's important, how to measure it, how to improve it. We certainly want to, I know we've bumped up against time here, want to respect your time. We will answer all the questions that came in individually. So if you have had a question, we will certainly be in touch with you. I want to close with this. I think this comes from that 2012 study from Australia. And it's just a quote from a patient, right? To put the patient voice first and foremost here. Somebody said, I've dropped in the past. And I think more how that they were able to relate as a person was probably the biggest indicator of whether I was comfortable with what they're doing. I suppose if you have a choice of 5 people with the same skill set, how they're able to deliver that skill set, that is more important than the skill set as such. So the delivery of our skill set and how we are able to communicate, work with our patients, do all of those things, so critical. Here are all of our emails in addition to several of our phone numbers. If you want to connect on LinkedIn, that is there as well. Make sure that you have these slides moving forward. Thank you all for your time. We are so grateful that you chose to spend an hour of your evening with us. Jessica, Zach, Carolyn, thank you all for the expertise, guidance that you provided for this. And with that, Haley, Steve, I'll kick it back to you.
Thank you very much. It was an excellent presentation. We are running low on time, so I'm going to keep it limited to about 2 or 3 questions here. But one of the questions came in was the panel team mentioned focusing on positive experiences from patients, but you didn't mention what happens with negative feedback. Is that something that's also focused on, recognized, or communicated in a different manner? Could you elaborate on that?
Yeah, I think that's a great question, and I think from a from the perspective of understanding complaints, right? That's a huge driver of satisfaction, how we actually manage that. And I think until we really hear from all of our patients, you know, what some of that negative feedback is. And Zach mentioned this too, just the safety to be able to provide that. So the functional feedback tool that I mentioned earlier, it's a little bit nerve-wracking to be able to have your name attached to that. So I do think that there's some level of anonymizing feedback that's really important in order to give patients the true voice of, hey, I want to tell you this because I care and I want you to actually get better at it, not because I want you to have a 1-star review or something online, right? Like I actually want you to get better at it. And so I think that there's definitely an importance of addressing those things and then working to make improvements. It's not just, hey, did I type something nice online that people can see that's like, hey, we really care, but it's like, did something actually happen that changes anything?
Yeah, that's definitely I think the most critical part is how you respond and what you do with the feedback. So the feedback is a gift, you know, and I would say over the years in my experience, I mean, I've leaned mostly into the negative feedback because those are the areas obviously I know I need to improve on, or our practice needs to improve. So we focus actually in the reverse. So we focus, this sounds negative, but we focus on the negative feedback as an opportunity for growth. And so it's really important, I think, that how you respond and show up, not just for visibility online, to Matt's point of responding to a comment. So you actually have to do the work. Again, the introspective hard work that I mentioned earlier.
Excellent. Thank you very much for that. The next question came in from a panelist, or excuse me, from an attendee that says, are there areas in CODA that address these skills and behaviors at this time, or does it need to be added to CODA?
Oh my goodness, we're going to extend to 10 p.m. tonight. I'm on the East Coast. You guys are wondering if that's like 4 more hours for you. Don't worry, don't get scared. But there are some, but I'm not sure that they are explicit enough to really drive the experiential learning that I mentioned earlier, to really have students in particular in community-based settings to understand different lived experiences that they may or may not experience with their patients once they are in practice. But yes, they do, to the extent that I think really drives change, no. And I think there's room for improvement there. And if anybody wants to get involved in that policy discussion, I will be meeting with CODA coming up. So reach out to me if you have any perspectives on that. I'd love to be able to share those.
Yeah, and I'll just add to that, Steve, in the sense that, I mean, there is a whole body of literature from around the world that's evidence-based around this, how you look at and how you measure patient experience. And some of those surveys are specific to pediatric and pediatric, parents answering on pediatric patients. Others are more generalized. And I think that there's sort of a lack of just general awareness of this, not only within the dental schools and inclusion in dental curriculum, but we're also in the process of writing a technical report at the ADA standards level to really start to address patient experience within dentistry and how that might look going forward.
Excellent. Thank you for that. And I think we'll wrap it up with one last question, kind of a summary question. How do the attendees measure and improve what they're doing in their office? Just what are some of the high-level points?
Sure. Well, I'm not in as sophisticated, I think, as practice as Zach is in public health, but we have regular case conferences amongst the doctors. We have meetings by department, so the hygiene team can talk about what's working, how is SDF been working, in our kids where we're trying to hold off treatment or not have to do definitive treatment. I think just looking at our dental materials, our systems, our workflow, it's just a constant effort. But if you have that time designated in your regular staff meeting time, then we make sure that those things get addressed. And I think that includes when you get negative feedback. And I agree with Zach, it's a gift. And the first thing I say is, thank you for having the courage to let someone on my staff know how you felt. And I want to hear more, and we're going to do the very best we can to try to address this. And just the fact you take that first step, I think means a lot to patient families, because that is not what most of us hear from most businesses that we walk into.
True. I would say a different kind. I think that we're focusing on that like trust building aspect of the experience, and so all of the many ways that you can do that. There are plenty of tools out there that focus on the convenience, and those are important and good. And we see, an opportunity to really help practices, certainly where I've spent my whole career is trying to understand this realm of how to measure this and then actually figure out what actually builds trust for patients. And so that's really what we're focusing on, and did work.
One last thing I would say, I mean, once the trust is built, the tools are very valuable, right? But if you have trust with patients, also engage direct conversation with them. So feedback doesn't always only have to come through a sophisticated tool or measurement system. Yeah. That can be done, face to face with the patient, where you're creating that space and really carving out the time and dedication to wanting to learn, how to improve. Again, I think dentistry, I don't want to generalize, I'm speaking for myself perhaps, but I think in dental education, in the first 10, 15 years of practice, you're really focused on so many different aspects that take time away, sometimes from focusing really on the patient as a person. So I'll go back to what I said earlier. I mean, it really, they're beyond doing, you know, an MOD on number 4, it's a person, right? And so I think that they want to co-create with you. I think that's a very unique experience you can provide patients, and you're going to get a lot out of that by co-drafting things together, instead of, you know, it just being, again, that power differential where you intrinsically hold the power, the patient does not, or the consumer does not, and then it creates more inequity in the system, and more distrust, more trauma, etc.
Excellent. I appreciate that. Thank you all very much for the feedback and the questions there. Haley, I will turn it back over to you for closing out.
All right. Well, yes, thank you to our presenters this evening for such a great presentation, and thank you all for joining in. To our guests, your CE certificate will be emailed automatically within about an hour or two, so be sure to check your spam folder as well. And also be sure to follow us on Facebook and Instagram for links to new free CE events. And the link that you see on the screen now gives you access to our archived webinars, including our panel discussion today, which should be accessible before the end of December. And that's the elevateoralcare.com/elevatingcare. So please be sure to share that link with your staff and colleagues. And finally, on our Elevate Oral Care website, you will find a link to request an informative CE eligible staff meeting, education on the latest evidence in oral health prevention to enhance the patient experience is what we do. And our team is eager to help your offices expand your preventive programs. So thank you all. Happy holidays. Stay safe and have a wonderful rest of the week.
Thank you, Haley. Thank you, Steve and Elevate. Thank you all.